So I'll introduce myself. My name is Ramses Jean-Louis. I am the Global Chief Diversity, Equity, Inclusion Officer, and I do a lot of other stuff at Pfizer as well, so come to me afterwards and we'll talk about it. I happen to be the proud son of Haitian immigrants, and I am also extremely proud of the fact that I work for a company that was founded by two immigrants 176 years ago in Brooklyn as well. So super excited to be here. Basil, I want to thank you for giving us the opportunity to be a part of this very important conversation. Love to tell you a little bit about Pfizer. At Pfizer, our mission and vision is to create breakthroughs that change patients' lives. When we talk about patients, we're talking about all patients, not certain demographics or certain socioeconomic classes. We're talking about everybody. At Pfizer, we have 4 values. One of my favorite is equity. Our values: courage, excellence, equity, and joy. For equity to work, we make sure we take a holistic approach to our diversity, equity, and inclusion strategy. So we want to make sure that we have inclusion and equity throughout our talent lifecycle, but also when we take a look at our patients, we want to make sure we have diverse clinical trials. We want to make sure that we remove barriers to access, and we want to make sure that we have equitable health outcomes as well. We take the same approach to supplier engagement. It is important for us to make sure that our supplier development and discovery approach brings a lot of people to the table, and our social investment strategy is very similar as well. So for us, it is very important for us to have a healthcare system and a healthcare ecosystem that have all the important players running at full capacity. So we're talking about all of the partnerships that you heard about earlier. So the private-public partnerships, the partnerships with non-for-profits, academic institutions. So for that, we need non-for-profit organizations to have the support and all of the resources we need. In order for us to be successful, it can't just be Pfizer and Merck and Lilly. We need everybody to participate. And the beauty about healthcare non-for-profits is that you're able to see things that other people don't see. What non-for-profits do is you see gaps and you see voids, and you come up with solutions to fill those. So we need you running at full capacity in order to really make sure that we achieve everything that we want to achieve. So I'm looking forward to a phenomenal conversation. I'll have everybody sit down now, and we'll jump into the conversation, jump into talk. So I would love to start off by actually having our panelists introduce themselves. So actually, I will start with you, Torian.
All right. Good morning, everyone. It's so great to be here. Thank you, Basil, for the invitation. So sorry I missed last year because it sounds like it's really been an insightful and thought-provoking conversation. Really happy to be here again with you all. Hi, Dr. Beverly. It's good to see you. So I'm Torian Eastling, as you see on the screen, as you've already heard. I am a family medicine physician, public health physician. Currently, the work that I've been doing, I've been sitting at the intersection of clinical care, public health leadership, but then also community empowerment. And really the work that has been really important for me is that how can you drive improvement on health, not just for individuals, but also for communities at a hyper-local level. And so some of the work that I've been doing now, as you see some of these titles, I've been really thinking about an intergenerational strategy, the things that I've learned, how can I impart some of those experiences to young people who are directly behind me. Either they are early career physicians, they are starting off in medical school, they're in graduate school, and even high school students. And so I actually lead a high school mentoring program for young black and brown boys who are interested in the health career sector. And we expose them through didactics and experiential learning to not only thinking about their careers, but what is their obligation and responsibility to uplifting their community. And so through the Young Doctors Program, we've been engaging close to about 100 black and brown high school boys and really exposing them. And now, which is really cool, one of our students who came through in 2015 is now one of the lead mentors. And so the program is working, and really, really excited about what's next. And then also, I just recently left the healthcare sector as a senior vice president for population and community health. And then prior to that, I did a very extended stint in city government. And so great to be here.
So Camille, my partner in equity and innovation, I would love for you to introduce yourself. And let's start off with, Columbia graduate as well.
Oh, you already know I was going there. Columbia graduate, but also native New Yorker. So I think, before I go into, first of all, thank you for having me here and for the invitation. This is really a full circle moment for me, because if you would have asked me 5 years ago, which is as long as I've been at Pfizer, if I would be at Pfizer, I would tell you that you're crazy. And I'm sure many of you are like, okay, why? Or you know why? Because I came from the public sector, right? And so, Dr. Vassan said in his introduction that we have to invite different sectors in, right? And I took a leap of faith, right? So a bit about me. So I'm an epidemiologist by training, of course, Columbia alum. And at Pfizer, I'm the Global Patient Equity Research Lead. And so what that means is that I'm really focused on thinking through how do we embed equity principles into all of the evidence that we generate. That includes, we talk a lot about clinical trial diversity, but even outside of clinical trials, the real world, the data that we get from patients' experience in their day-to-day lives, right, and the hospitals. So how are our scientists leveraging those data to talk about our medicines and vaccines, effectiveness and efficiencies once they are out in the real world? So it's my job to really partner as a strategic partner across the organization to think through whose voices are being included in the data, who's being left out, who can we partner with externally, strategically, to ensure that all patients are represented end to end, within the medicine's development pathway. And so I have a really, really cool job. And so a lot of the work that I've done over the 5 years has evolved. And I think that evolution speaks to the sector that I come from, the public sector, being resilient and going with change within corporate. And so, really here, just excited to have this conversation, excited to think through with all of you in conversation. I have my own notes that I'm even reminded of, like the journey here, but also how I'm navigating the changing environment at Pfizer. So thank you, and we'll get more into detail during the panel discussion.
Thank you. Dukla.
Good morning, everyone. Yeah, I know. Yeah, good morning, everybody. All right, great. There we go. So I'm Dr. Dukla Shaw. I'm a pharmacist from Brooklyn, New York, first generation Haitian American. So my parents came here from Haiti in the 80s, but we were born and raised here in Brooklyn. Went to Brooklyn Tech for high school, and then went to Howard University for undergrad and my doctorate in pharmacy as well. So I've been a pharmacist practicing for the last 11 years. And the last 7, 8 of those years have been primarily in the medical cannabis space. So really passionate about integrative medicine, natural medicine, and the opportunities there. But separately, I'm the founder of Paradigm Health. So we're a boutique agency that sits at the intersection of community, healthcare, and culture. And we're the engine behind Black Health Connect, which has grown to be one of the largest intergenerational, interdisciplinary networks of Black professionals working within the healthcare ecosystem. And our nonprofit, Black Health Connect Foundation, does a couple of things, serving our community via education opportunities, licensing grants. This year we gave out $15,000 in grants to help people take their licensing exams, because sometimes that could be a barrier post-graduation. And then also other impact work like community health fairs in communities like DC, but also internationally in Accra, in Ghana. So our organization, our community was really just built on the need for ecosystem that wasn't there. I think a lot of the healthcare professionals are very, very siloed in their specific profession, and there was an opportunity to bring all of us together. Being a graduate of Howard, it was something that was just normal to me. I was on the campus with a medical school, a dental school, pharmacy, nursing program, so we all kind of were interconnected through our matriculation and then still stayed connected afterwards, which allowed us to support one another in our professional careers. But I've had friends who were the only one in school in their class, right? And when they graduate, the same lack of diversity you see in healthcare and the professional spaces, that same lack of community, right, still exists. So having a space where you could come together and find people that can mentor you, help you on your pathway, was really important. But also, what also came out of that was the opportunity to build true infrastructure and the ecosystem, because healthcare isn't a siloed thing. There are folks in pharmacy that deal with physicians, that deal with people on the policy side, right? We all work alongside healthcare administrators, and there aren't that many spaces where we're all sitting in the same room, and we were able to create that. So excited to be a part of this conversation and talk more about the work that we're doing, and thank you for having me.
Thank you, my Haitian brother. You know, I failed to mention as well, I'm a Columbia graduate, graduated from the law school in '97, so super excited to be here as well. Before we actually jump into the discussion, I always like to start with a very simple question. How are you doing? How are you doing today, and how are you doing in general? Camille, would you like to start off for us?
I am doing very well right now at this moment because I'm here in community. This morning I had a very difficult morning. My kids woke up at 3 o'clock in the morning, but nonetheless I am here. So doing well. Thank you for asking.
Awesome. Good to hear. Dukla.
Definitely similar answer there. I'm really excited to be here, but also, you know, I think somebody growing a business and an opportunity, I think you have those Q4 jitters, end of the year, how are we planning out next year? So that there's some of that in the background as well, if I'm being honest, but always excited to be around community. It's always great. So, yeah.
Good to hear. Torian.
Yeah, so, you know, despite everything and some of the challenges that we heard earlier, you know, even right now, I feel optimistic and hopeful about this moment that we're in. The last title, which I intentionally did not mention, and so I do serve as the commissioner, one of 15 commissioners who's on the New York City Commission on Racial Equity, which if you voted in the 2021 election, you most likely voted in support of the city, including in the city's charter, that this city would be dedicated to racial equity. And as part of that vote, those ballot measures, it was the establishment of the Commission on Racial Equity. Just last night, NYC Core just released its first report, and a Truth, Healing, and Reconciliation report outlining plans of how we're going to study and design a Truth and Reconciliation Reparations Committee for New York City. It is one of the first of its kind for this municipality to actually embark on this endeavor. And so I remain optimistic about what's to come. And I think there are also opportunities, there will be grants that will come out of this process, 17,500 for nonprofit organizations to host community conversations around this truth, reconciliation, reparations process. So I know we're going to talk about funding, but here you go. You know, there's an opportunity there.
We like funding. We like funding a lot. Thank you. Torian, I'll stay with you for a moment. You know, you have a fascinating background. You've played different senior leadership roles in the public sector and in the private sector, non-for-profit. You've taught medicine as well. How have those different roles influenced your perspective and just how you see things and trends that you're noticing and observing?
Yeah, I mean, I think, you know, it's sort of, you know, trying to be intentional about the work that, you know, I do, really thinking about, right, what is, you know, my moral compass and staying true to that as much as possible. And as I talked to you all in my intro, you know, understanding these intersections around clinical care, around public health, also thinking about neighborhood and community empowerment strategies, I think, you know, some of those common threads that have been really important to me as I move forward in my work. One, and we heard this earlier, I think we always have to center trust and relationship building. You know, a mentor of mine told me very early on that we have to think about what is your inside-outside strategy. You work in institutions and organizations to continue to advance on the deliverables of those organizations, but you always have to remember what are the priorities of the community or the audience in which you are serving. And so thinking about your inside-outside strategy in whatever institution that you work in is paramount. Whether you're thinking about trust between patients and providers, whether you're thinking about between communities and institutions, or the public and policymakers, trust is paramount. And while it is very difficult, I think the important point is always thinking about how you acknowledge how trust has been harmed and what are those strategies. And those strategies may be different, right, in each of those sectors, but identifying strategies to repair that trust is important. And we certainly try to do that. As you heard Dr. Vassan earlier, as we launch a lot of our vaccine strategies and testing strategies in New York City government. The other two, I think, are really important, but trust isn't, I think, so critical to getting to the other two. The other one, I think, is equity and access. We know the challenges, the current challenges, and really trying to meet the needs of vulnerable populations. Again, we heard a lot of this earlier, and what I'm not necessarily speaking to folks who are in this room, but maybe we cannot retreat from the work that has been done. And I think we just have to continue to hear that reminder that a lot of the investments that we made prior to 2020 and in 2020 during that racial reckoning and where we are right now, we need folks to really stand their ground. And that requires courage. And I think the courage to really act. You heard some of this. There's decision making when you do not have all of the information at hand. And there were so many times, during the pandemic, where we didn't have all of our data disaggregated. We didn't know what was coming from other cities and municipalities in other states with regard to the spread of COVID-19. But in those moments, you are relying on your competence and your confidence that you are centering equity and access, and that you are driving towards improvement of care for individuals, and particularly those who are most vulnerable. And I think courage also allow your staff and your employees the license to be innovative. And quite often, we weren't leadership in government making the decisions. We were really relying on folks on the ground, folks who are in the neighborhoods, community-based organizations, who are willing to go out there, essential workers, who are willing to go out there and risk their lives to do what was necessary to protect New Yorkers. And I would say that we have been able to save thousands of lives in New York City because of the courage, the courageousness of folks and the boldness of folks to act. And I think those are the threads that have been really, really important for me, and certainly in partnership with so many nonprofits and community-based organizations have really taught me in that insight.
Those are really great insights. And the first thing that come to mind is I'm thinking about the saying that we've all heard, progress moves at the speed of trust. And that's where you all come in. You know, at the end of the day, if you're at Pfizer or at Merck or Johnson & Johnson, any of those companies, when we think of a health equity initiative, the first thing we think about are who's the boots on the ground. We may have some credibility in some communities, but no one has more credibility and more trust than all of you who are the boots on the ground doing the work each and every day. Camille, would you like to add to that at all?
Yes, absolutely. Ram, you mentioned our core value of equity, and it also is my favorite. But one thing that I've seen really is this transition of equity as a value advisor into more of an operating principle. And it comes forward in us building those connections with the community and just showing up, right? And showing up and talking to the community and letting them know this is what we care about, we hear what you care about, and having that conversation. So really creating that shared agenda.
Absolutely. Ducla, would you like to add to that?
I think something for us has been at the core is that community is at the center of all change, right? So, and that's why we love bringing together the groups that we bring together, because that's how we truly get to understand what's needed in those spaces. And that's the power I think you all have with your organizations as well, is like, how do you build community around the mission that you're building, finding those people that will always be there, always support, right? Regardless of how institutional strategies change or partner strategies change, if you have that core group, it'll allow you to advance your mission as you go on and find different ways to pivot.
So the theme of your conference this year was community now more than ever. And again, I'm extremely proud of what you've been able to accomplish and achieve and the network that you've been able to put together. Tell me, what motivated you to start Black Health Connect back in 2018? And if you could talk a little bit about some of the major accomplishments and achievements that you've had since then.
No, yeah, definitely. I honestly, the real reason is kind of selfish. So, been in healthcare. By the time I moved back to New York, or the time we started Black Health Connect, I was practicing for about 4 years. But always have had a passion for community engagement, building community on campus. I'd be doing programming, hosting events, things of that nature. And New York was still doing that in some form or fashion, but it was separate of like my identity in healthcare. So one day I just said, hey, like, I want to host a networking event for healthcare professionals. And at that first event, again, building community, figuring out what the community needs, that's when I got a ton of feedback about how impactful having that space was. People were meeting folks that worked at the same institution as them that they had never had the opportunity to meet. Like healthcare isn't a space where, or some healthcare organizations don't have like the same employee resource groups, right, that you may see at larger corporations or in the tech space. So they were able to find contacts, find people that could help them in their mission. And that's when it clicked for me that the experience I had at my HBCU was not the normal experience. So we started to do those community engagement events, networking events quarterly, and what started as a 50-person room is now a community that's touched a little bit over 40,000 folks across 24 cities. And then we've been to Ghana, we've been to Kenya, and then we've also established a community in the UK. And every time we go into a new network, it's great when we come back because we've also essentially built infrastructure for an ecosystem. So organizations that were working in the same market, working towards similar goals, would meet at an event, and then you start seeing them co-hosting and co-sponsoring programming, right? Or working on a project or initiative together. So again, for us, we recognize that there's a lot of opportunity and shift that can happen in healthcare, and we just want to be that catalyst in the middle that helps to speed up that change, and people find partnership, find strategy, find the folks that can support them. And even for professional growth, there's people that have come to our conferences that have gotten hired by sponsors from our conference that are in the room, right? Or found business partners, and all of those things are just speeding up the change that we want to see in the healthcare ecosystem to impact health equity and health outcomes.
I actually think I reached out to you a couple of months ago because I received an email from someone that I met at your conference, and she said that she started at Pfizer like a couple of months ago. Very senior leader, great talent. Again, when we're looking at partnering with outstanding organizations, that's what we're looking for. We're looking for great talent, and we're also looking for folks that have that trust in the community where our initiatives can go further. So again, thank you for that leadership role. Now, I want to share the wealth. I don't want to be the one asking all the questions. I want you to think of some questions. If you still have that QR code, please leverage that QR code. If you have any questions, I'll ask a few more. The question that I have for the panel now is, again, based on the conversations that we've been having, what trends have you been observing overall in the non-for-profit space? But again, trying to be solutions-oriented. What are some best practices that you've been noticing? What are some things that some of these non-for-profit organizations are doing that's really taking that time to outsmart the moment? That's what we all have to do. We have to outsmart the moment. So if you can speak to that, that would be awesome. Torian, I'll start with you.
Yeah, I think, it's going to sound like, we just this is a sort of rerun of the first panel, but I just cannot emphasize enough some of the points that were raised earlier about collaboration. In this moment, I think it is really critical. I'm just going to highlight a couple of ways in which I've seen some really strong partnerships between nonprofit sectors, healthcare sector, government as well. And I think this moment is going to continue to require that level of collaboration. I no longer can say unprecedented because we certainly seen the level of collaboration that was really important for mutual aid and really shoring up our safety net and providing critical services for individuals who are vulnerable during the pandemic, and I think we need to learn a lot of those lessons. So, and just sort of thinking about, we heard earlier the Medicaid waiver, and so the Medicaid waiver was approved by New York State in 2024 by Governor Hochul, was approved then, and really allows us to take our Medicaid dollars and be innovative enough to sort of reallocate those dollars towards a particular project. And as you've heard earlier, the dollars are now being thought about how can you sort of support these social care networks to address social needs, social determinants of health, but not sort of running that funding through healthcare systems, which we have traditionally seen with Medicaid waivers. A lot of those dollars have gone to healthcare systems. But what was so powerful in this waiver is that there was a huge focus of the dollars that was through the Medicaid waiver. 75% of those dollars are going to community-based organizations, right? And really thinking about how to begin to shore up community health workforce, so community health workers and doulas, violence interrupters, but also thinking about how do we speak clearly and emphasize on what is important to you all and then what is important to the healthcare systems, whether you are a managed care organization or hospital or even a biomedical company, right? And so they've not only funded what was called social care networks, but we've also now funded what is called a health equity regional organization, or HERO. And so the HERO's responsibility is thinking about how do you take data from both all these different participants and then translate it into thinking about impact and success. And what are those metrics that are really important for nonprofit, community-based organizations, but also healthcare organizations as well. And so the HERO in New York, for New York State, is the United Hospital Foundation. Know that they're not responsible for giving money, but they're really a think tank, a do tank, and they're really using policy and data to drive change. So UHF is the Health Equity Regional Organization for New York State. And as you heard earlier, there are 9 social care networks throughout New York State. There are 4 here in New York City who are responsible, really, for doling out those funds to community-based organizations. And here's why they are so important, is because some of the things that healthcare sectors cannot do is really, as you heard earlier, is get really direct to individuals who are most vulnerable and bring them into the healthcare system. And so we really rely on community-based organizations who are really close to individuals to engage them, provide direct service, but then also have the opportunity to bring them back into the healthcare system. So one way that we were thinking about this, in the healthcare organization I was just in, we wanted to drive or reduce ER utilization, particularly among our pediatric population and our adult population as it relates to asthma and respiratory disease. And so one of the ways that we were thinking about this is how can we use healthcare dollars, Medicaid dollars, to really address housing quality, not housing availability or housing accessibility. We were already engaging folks who had residents, but we knew the quality of their residents was not up to par and was driving their health outcomes: mold, asbestos, pest issues. And what we found is that when we were able to drive about $100,000 in a hyperlocal way, in Brownsville and East New York, we saw a reduction in our pediatric and adult asthma cases that were coming through our ED. Now the question is, how do you bring that to scale, right? And that's where partnership and collaboration is going to be really important. So really thinking about the full ecosystem to bring something like that to scale. The evidence is there. And we've seen it not only in this country, but we've seen it in other countries as well. When you can do integrated pest management, you can use a community health workforce, you can really drive change in a hyperlocal way and really improve health outcomes. So I think those are, the opportunities that we have right now, and then some opportunities when we can think about collaboration in a really intentional way. Understanding what are our strengths within the healthcare ecosystem, but also the strengths of community-based organizations and nonprofits.
I love that. Really great insight. As opposed to just focusing on the symptoms, let's look upstream to kind of see what some of the drivers are. Camille, love to kind of get your input on that as well. What have you been observing? What have you been seeing? But most importantly, I want to, as a non-for-profit, that's who we have in the audience. If someone wants to work with Pfizer, if somebody's interested in kind of showing up, what do you look for? Like, what are the metrics that's important to you to be like, all right, this is an organization I should partner with because I'll get a strong ROI on my investment?
Yeah, Ram, it's a great question. And I think, the first panel touched on a couple of things which were really strong points. And I'll start with really just showing up as a strategic partner. Right. And so I think that, when you're approaching a for-profit organization, a corporation, it's not so much perhaps prior to the days where, hey, I'm looking for funding, I'm looking for grants or sponsorships. Now it's, I've checked out your mission on your website. I see what your values are. I see what your priorities are. Your priority is oncology, my organization, it sits within a community that is disproportionately burdened by breast cancer, prostate cancer, and I know what the community needs. And so how can we work together to really address these challenges that the communities are experiencing? And so then you start the conversation from there, right? I have something that you need, right? And how can we work together? That is very much how I have seen organizations come to the table recently who have been successful in securing partnership. So that's one thing. So it's really more about partnership. So I see us moving, reprioritizing. Someone in the first panel said, we're not walking away from, funding, but we're reprioritizing how we're approaching certain issues. And so that looks like collaboration, partnership. It looks like talking about what are the expected outcomes up front. So many of my leaders will say, hey, Camille, this is an amazing, organization that you've identified to partner with. So what can we expect? What is that return on investment? Is it real? And I'll say, I think Dr. Vassan said that, when it comes time to talking about budget cuts, he'll ask his, team, what is the impact? And we can say, well, the impact takes time. Yes, we know that, right? We know that eliminating health disparities is a long game, but there are process measures along the way that we can communicate. And the value of storytelling, I can't emphasize that enough. If an organization can tell their story well, it moves mountains. So it's not so much just saying, metrics, okay, cost savings, how many patients are reached. It really is about talking about the lived experience. Bring a community member forward, to share their experience based on the work that your organization has done. How has it changed their life? How has it impacted their family? How have they been able to grow even in terms of their own professional development? So there are many ways to communicate that impact. So there is very much in the space of health equity, a social impact and a business impact. And we always have to be talking from both perspectives when you are looking for funding from the private sector in particular. So those are just some of the ways that I've seen organizations be really successful in securing funding and partnerships. And the last point I'll make also is about scalability. Can you demonstrate that your initiative and your program is not just a one-off, that you can scale your initiative into other communities? Have you demonstrated success? Is it feasible, right? These are many of the principles that we learn here, in health policy and public health. Bring that forward to these funders, especially in corporate. But most importantly, speak their language. I mentioned reducing health disparities. Talk about, you will have an increased market, right? Market access. You have a competitive advantage against, your peers. So bring that finance language to the table, because that, again, is what will make you stand out.
Thank you. That's great feedback. I would also add it's important to have persistence as well. A lot of times we'll find small businesses and vendors come up to us and they want to do business with Pfizer. Last year, we actually had a conference where we brought in a lot of small vendors who was interested in doing work, and we brought in folks who we actually do work with. And some of the stories that we shared, and people were just telling their testimony, there's folks that's like, hey, I've been trying to do business with Pfizer for 3 years. I've been responding to RFPs, and it's never really gotten anywhere. And some people are like, hey, I've been doing it for 5 years. But when I got my first contract after 5 years and I got my foot in the door, then the work just didn't stop. It became a floodgate. So sometimes we'll try to partner vendors with folks who are already doing, but it's important to be persistent. And again, it might not happen the first try, it might not happen the second try. But again, think about it. Whenever we talk about building relationships, it's never transactional. You're thinking about the long term over time. You continue to be persistent, we'll find an opportunity to partner and work as long as you continue to deliver on your mission and your vision as well. So we're going to open it up for questions after we hear from Dukla. We want to make sure that he has an opportunity to weigh in, and then we'll take your questions. So again, use that code if you have any questions. Dukla.
I think the last two answers summed it up pretty well. The things I were going to point out were, one, the collaboration piece is key, especially if there are other organizations with similar missions in your ecosystem. How do you all leverage the strengths that you all have to execute one common goal? There are folks that we work with where we have a great way of filling a room and getting a lot of folks to a space, right? But they're focused on a certain mission, so we'll collaborate on a project together to make sure it's extremely successful, because that goes back to the ROI for whoever is sponsoring that event or donating or supporting that organization, right? Because again, the next piece was the ROI piece, just being aware of what these organizations are looking for. And being able to speak to that, like the data that you have is extremely important. I think whenever I'm talking to an organization, our deck has our stats, how many people are in our network, the different professions that they're in, the cities that they're in, right? And because that allows them to see how we better fit into the strategy that they have. And then the last piece, I think, is like really, well, not the last piece. I think focusing on the relationship and building the relationship allows you to understand what your partners need. People who are making these decisions, that are investing in your organization, this is a part of their job. They have their KPIs that they need to hit. How do you support them in being successful? What does that look like? And sometimes it might start off with a smaller opportunity that you can show and improve on. And then again, with being persistent, the next year you can have the project gets bigger, right? And you can scale that with that partner after building trust. I think the other earlier question about outsmarting the moment, I think their labels have changed, but organizations that are really true to these missions, right, that hasn't changed for them. So sometimes the titles might look different, the way the health equity might be population health now, right? Organizations are talking about things differently, but they're still trying to do the work. So it's also supporting them and speaking that same language as well. So like I'll say, for example, for us, difficult year, executing our conference, we lost a ton of partnerships at the top of the year that I was for sure knew were guaranteed for the summer, and spent like that whole spring trying to find new partners. And one quick pivot we made, which honestly I think was a part of our growth, our BHC conference, instead of we just bridging healthcare communities, which is what we do, right? So Black Health Connect may not be able to be on the invoice for some organizations. So how do you still do the work that you're doing while still supporting your partners so that they can support you? I think all that is extremely important to be mindful of.
All right, the power of the pivot. Great insight, thank you. Do we have some questions from the audience? Great.
Thing. Put on my glasses. How do you stay morally courageous in times when it's seen as controversial to do so?
Yeah. Powerful question. Who would like to kick that off for us?
I think if we're in mission-driven work, you really don't have a choice. Most of us start organizations like these to impact status quo or to make systemic change. I think we've gone through an era where we had the privilege of like the system being implicit in the change we were trying to make, but like typically that's not what you're gonna see, right? We're trying to change systemic inequalities, we're trying to make a difference, and we're gonna get pushback, and I think that's the time that we're in now. So it's like, this is the work that you really wanna do. I think understanding it's a part of what you signed up for, and doubling down on that work, doubling down on that mission, and continuing to find the people that are gonna support you through it. So that's what it is for me.
Yeah, totally agree. But just a reminder that we've been here before, and quite frankly, I think the nonprofit sector has so much to share with other sectors about how to be adaptable, about how to be resilient, and how to be collaborative, right? And thinking about how you diversify funding, bridge funding, and thinking about, particularly in moments of crisis, where are those outlets that you turn to? And I'll just say, I think courage is really, really important, and really just standing 10 toes down on what you believe in the direction that you want to go in, but also know that you are not alone in this fight. And just having that reminder, if you're not in coalition, there are hundreds of coalitions, particularly in New York City, ways in which you can use and leverage grassroots tools to push on your agenda or make sure that you are advocating for what is necessary for your catchment area or the population that you're serving. And I think that has to be part of sort of your calculus, that you're not just out here sort of pushing against sort of the system and the machine by yourself, right? That there are so many others who are working with you. And I think identifying those partners in that way, I think, would be really helpful.
You said courageous, and I like to be sneaky about things. Really, it's like when I put like vegetables in my kids' food, right? So they can, and I hide it in there. We have to think about ways that we just slip it in there, right? We have to be 10 steps ahead of others and really preemptively think about, well, where might this fit in their role, in their organization? Make it work, make it fit. People will not, during this time in particular, people are not going to say, hey, how might I think about equity in my own work, right? But you can suggest, hey, how might we, perhaps include some patients that have a higher burden of disease, for the asset that you're working in, right? I mean, these are the ways that representative science is good science. We know that, right? It's how you build credibility. And so for me, I just very much speak the language of science at Pfizer, and it has gotten me a long way. So I stay grounded in science.
Great answer. I actually have a quote I was going to use later, but I'll use it now, and it comes to mind by Margaret Mead, and you've heard this before, but it seems really relevant to me. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. So being a Chief Diversity, Equity, and Inclusion Officer, I've seen a lot of change take place this year. And to be honest with you, I'm a man of faith. I actually pray for guidance that as long as I have a seat, I'm going to use that seat, and I am going to speak up. However, I'm going to be strategic about it. I'm going to be smart. I'm going to be principled, but pragmatic. You have to be able to read the room and to know how to outsmart the moment. If you're going in talking about things that's going to put you more at risk because you just want to hold on to yesteryear, which was a year ago, that might not necessarily work. You got to think that we have to innovate in this space right now. And the reality is, I'm telling all of my peers and all of my colleagues in the space of diversity, equity, inclusion, we're being forced to innovate, and that's okay. You want to know why? Because at Pfizer, our R&D department is being forced to innovate. China's coming at us hard with some incredible biotech. In manufacturing, we're being forced to innovate. So all over, with AI and everything, every department now is being forced to innovate. So it's okay that from an equity and inclusion perspective, we're being forced to innovate. Don't get me wrong. I'm not in love with what's prompting it, but we got to get with the program and make it happen. Thank you for that amazing question. I have another question.
We have time for two more quick questions. The first is, do you, and I'm combining a couple here, do you think there is an uptick of medical mistrust among the Black communities? And if so, how do you engender that trust or trust?
Yeah, I think we can all sort of speak to it. I don't think that there has been an uptick, truthfully. I think that we are sort of seeing the status quo, and I think there's been a lot of focus on sort of that mistrust, particularly over the last 5 years. And the reason why I think we've sort of seen this uptick, obviously, during the pandemic and just trying to distribute vaccines across the country gave more awareness, not only to the inequities that we see in our healthcare system, but really to these issues around access. And I think it also sort of called attention to how messages are curated and who often is the messenger. And so I know that there's been a lot of work around measuring misinformation, disinformation, and I'm certainly that some of the work that's happening here with narrative and storytelling, and I totally agree with Camille. I think we have to sort of figure out what is the story and who is the messenger, And quite often, and I know Giving Tuesday is coming up, and many of the nonprofits are going to be thinking about Giving Tuesday. Really finding that messenger, I think, is really important. And really trying to curate a story about some of the inequities that you are seeing, but doing it in a way that's really highlighting what is at stake, right, in this moment. And we've heard about the cuts that are happening to Medicaid, the cuts that are happening to SNAP, and there's so many other critical services that are going to be impacted. I think, honing in on those critical services that are going to be impacted, both in the government space, nonprofit space, healthcare space, I think will be really, really important. And I think that's also how you can both uplift your message, but also sort of educate people in this moment as well, because I think that education is going to come from sort of all of us, right? It's not going to just come from government. It's not just going to come from healthcare. We all need to educate folks about what is at stake right now.
Thank you. We'll take another question.
Okay. Can you share a story or moment that reminds you why you do this work? There are a lot of stories.
There's a lot of those. I think, I have a few. I think the biggest one for me was the first time we did Black Health Connect Mixer in Accra. We had folks from the continent of Africa. We had folks from the diaspora from Europe. We had folks from all over the United States all in one room, having conversations, making new partnerships, people that started doing work in Accra after we left, people that connected when we did our first mixer in London that came to London and networked. But the biggest thing I got out of that was just understanding that these spaces were necessary everywhere. I think I'll speak for my experience here. I think as Black Americans, we have gone through a lot here in the States to grow, to get to a certain place, to get to equity and equality, but also recognizing like that need is needed throughout the diaspora. Like our work is needed everywhere. So it just really pushed me to keep going and wanting to continue to expand that. So that's just one of the moments for me.
There are many moments. I'll just say one in particular. During my high school years, I was a community youth advocate in the Hunts Point section of the Bronx, and we worked with the American Cancer Society to advocate for the banning of the sale of flavored tobacco cigarettes. And that experience for me was really transformative because it showed me the power of youth and the power of community and the power of advocacy. And we were successful. And these were teenagers from the South Bronx, creating a coalition. We would go after school, and our voice was powerful. And one of my friends, who many of you will know her, Assemblywoman Amanda Septimo, she and I were part of this organization together. And look at her, she's the one that helps our, mayor-elect with his wonderful Spanish campaign for his election. So that, to me, is just a reminder of where I come from and the impact that I have had for many years, and that in places where many people will think that people like me probably cannot have an impact, or we don't see many of us in the room, we surely continue forward and we remain resilient and we demonstrate that we can do it. And so, that's a moment I'm reminded of.
Yeah, I totally agree. I think it's going to be the small moments, and I think it's going to be a collection of these small moments that are going to overpower, all of the pressures that we're feeling right now. I still remain totally surprised about how the commercials that I participated in, during the pandemic had such an impact on people. Even yesterday, I was on the B25, and so I'm a Brooklyn kid. So I had a chance to. I was going to pick up my kids, and someone just saw me and said, "Oh, there's the city doctor that was on the commercial." So I'm always shocked that still folks recognize me. But one thing that really just continues to sit with me now is that during that one of those moments, I met a mother who talked about how her kid grew out his hair because I was on the commercial and now wants to be a doctor. And it was just reminding about the superpower that we all have and the obligation that we all have to just own the moments that we have when we step into rooms. It is you. You have that power, and I continue to just sort of reflect that when I see, young Black boys that need that reminder about their value in spaces that they get to occupy, and when they walk into rooms, they have so much value and they have so much power, and I think that we get to reflect that for them quite often.
Thank you. That was an amazing question. So thank you for being an outstanding audience. One final round of questions. Usually we like to end it with a call to action, but I want to do it a little differently. I think you heard some great suggestions from the earlier panel. And if you do want a call to action, come find us afterwards during the networking. The question that I have for all of you, in about 30 seconds, this work is so personal and you care about it and you put your heart and your soul into it. How do you take care of your mental health? What do you do to take care of you? Ducla, I'll start with you.
I'm actively working on getting better at this, but definitely exercise and working out, but also just taking the time to fully disconnect. So for me, that's traveling. After a big project or a big initiative, my wife and I would just go somewhere and just get away, even if it's upstate New York or something. So yeah.
Thank you.
Yeah, I've started the practice of journaling, and even if it's just one line, that's enough for me. So just getting all those thoughts out of my head onto paper, but also Pilates. So Pilates actually helps me get into my body, right? So it's sort of like I work in these both ways, and again, I'm not perfect at it. So I'll be consistent one week, and the next week I fall off, but at least I know what works for me, and I know I can always go back to that.
Yeah, so two things that I've recently started restarted. One is just walking around my neighborhood, even, and I was just talking about the bus ride. And so on public transportation, but I'm now just walking around and just, enjoying my neighborhood. And so then one of the things I've been able to do is just make time for myself. Shout out to Life Wellness Center in Brooklyn and Bedford-Stuyvesant. Just been doing more massage and acupuncture to really just focus on myself. And so I've been more consistent. So I've already done 3 weeks in a row, which is huge. Trying to find time just to schedule those appointments. But I think that's been really important for me.
Dr. Torin Easterling, Camille Jimenez, Ducla Charles. Thank you so much for being here.
Thank you.